So you're here to learn about a grant opportunity. Possibly maybe you just heard about this through your emails. We had a lot of our staff sending this out through emails as well. So this might be your first time hearing about it. Thank you for being here. If so, we're going to talk today about the Connecting Schools to Care for Students initiative. This is a federal grant that the organizations on the screen have received from SAMHSA. And so we are kind of the coordinators of this grant. This is an opportunity for us to partner with your schools. So this isn't a grant that you'll apply for. This is something that we have. This is free for your schools to participate in, and it is a school level initiative as well. So some of you might be district folks, maybe building folks. Just know that this is something that, a few schools can participate in, all can participate in, whatever the reach feels like is kind of fits your district. So just being mindful of that kind of the what of today. And so just some learning objectives for us this morning. We're going to talk about what is Connect. There's some brief history I'll go through with you all just to kind of get the background. Who are we currently working with? So sometimes when I meet with schools, kind of at this first entry point of hearing about Connect, they're like, who are you working with? Do you work with districts that are like us, that are located near us? So we'll show you kind of our outreach map. What are your goals, or what are your goals? Excuse me. What are our goals with you? So we'll kind of talk about how we have done that work thus far. We are in year 3 of this grant, of year 4. So we do have some outcome data that we can talk about how this has been going with our schools. What can your school get from this? So we do have an incentives process where your schools can get paid for this work. So we'll talk about that. And then how can you make that happen? This is the second of our 2 listening sessions. Our thought was to get our, social workers, counselors kind of briefed on what this is first, because they're often the ones that are kind of driving this work. And then we wanted to get you all on board, being the district folks, being kind of the leaders in your areas, to know what can you do to make this happen. So we'll talk more specifically today on next steps. And then I talked about the outcomes, and then you'll also hear from our partners. So we have a variety of different folks from Carelon here today, and Favor to talk about their connection. And I'll talk about what that means in a bit. And we also have a video from a current school that's enrolled. We didn't get to play it last week. If we don't, I will send the slides out to you all, like I did last week, so you can see it if you'd like. All right, so starting off, these are our partners on the screen. All of these organizations are kind of working together on this Systems of Care grant. What that means, System of Care, is kind of been this work that the state of Connecticut has been doing for the past 10 plus years, really. Post Sandy Hook, I think our state really took a look inward and saw that we have a lot of different services existing in our state. We're very robust, family services, all of those things. And a lot of times our families don't really know how to navigate that. They go through a different door to get to what they need. So I think it was realized that we really needed to systematize our process and talk about the whole system of care, right? So looking at all the providers that are touching those children and how they're communicating together. So that's kind of the system of care work. This is our 4th iteration of Connect. So we've gone through rounds of Connect over the last 10 plus years. And this iteration is actually the first iteration of Connect where schools have really been intentionally involved in this kind of work. So again, I mentioned it was really a community grant up until iteration 4. Now our schools are really looped into this. So what that looks like so far is this. And actually, we had one new school from East Hartford enroll last week, so this is just a bit outdated. But so we are working with 63 schools across the state. So you'll see the colors kind of get darker in certain towns. That is because the darker the area of the town, the more schools we're working with in that area. So again, I mentioned one school can enroll in some areas. We have one in Colchester, Chaplin, Plainfield, Norwich. But other schools have tried to enroll more of their schools. So East Hartford, we have, I think, 7 or 6 now. Killingly, we have 6. New Britain, we have 12 or 13. So it's kind of just on the onus of whatever the district feels makes sense for them. A lot of times districts want to roll it out district-wide, but sometimes, like folks like New Britain and Waterbury, you're a very big district. So we kind of work with the folks that we engage with. All right, so our goals. These are the 4 goals as they are written in the grant. I find that when I meet with schools, I kind of want to talk about more so like what that means and what that looks like versus just the terminology that's used in the grant. So I'll go through each of them and then talk about really what that looks like. So first goal, expanding the infrastructure for school and community-based behavioral network of care. So what that really looks like is you'll hear from some Carelon and Favor folks towards the end of this call, but you saw all of those organizations on the screen. So when a school enrolls with us, the first meeting that we have with them, we coordinate CHDI having your region's network of care manager and your family systems manager there in person at the table meeting your school staff, like your kind of targeted school staff. So social worker, counselor, classroom teacher, kind of that subset would be the team at the school. And we would come into the building, meet you all, talk about the services that each of those organizations can provide, and just get to know each other. Because I think oftentimes that personal piece of knowing that person, having met them in person, shaking their hand, makes it so much easier to reach out to them and ask for help. So that is kind of how we're helping to integrate that school to community-based network of care. There's other ways that my colleagues will talk about in a moment, but that's that first goal. Second goal, expanding school and family awareness, knowledge, and access to information about behavioral health, trauma, and crisis response. Variety of different ways we get to this goal. I won't go into too much detail now, just knowing the time that we have, but we offer a variety of different trainings to our schools, all free, through this partnership. So that would touch your teachers, your counselors, your families. One of the biggest and greatest things about this partnership, I used to be a school social worker as well. So I know oftentimes those folks don't get the best professional development that they need to do their job. So Carelon does a really great job at providing some of that specific behavioral health, community-based training for those folks. So we can provide that during your normal PD time, right? So they would be pulled out and given that PD. Family training as well. Favor will talk about that, all those great things. Third goal, building the capacity of your schools to access these things. There's a variety of different ways that capacity needs to be built across our state in school mental health, but one of the really great ways we do that is through our incentive process. So every goal that a school completes with us, whether it's the needs assessment, which I'll talk about next, whether it's a training, whether it's sharing resources with families, that school team gets paid for their work. So as a school does something, they can invoice with us every quarter. If a school doesn't do something, there's no penalty, there's no deadlines. We're not going to be, we know things happen. And every school is different in what they need. So there's no penalty for not doing something. You just don't receive the payment. Oftentimes that's a wondering of the schools. And lastly, implementing and sustaining equitable and comprehensive school mental health supports. So we do that through the means of a needs assessment. Again, I won't go too much detail into it, but we do utilize the SHAPE assessment. SHAPE does stand for School Health Assessment and Performance Evaluation System. This is a national tool that schools can use to kind of assess their system, look inward, and see, MTSS, screening, all of those areas, where can there be opportunities for growth? And then you'll see on the right-hand side, our team at CHDI, if you decide to kind of bump up in level, schools can participate at 3 different levels. I'll talk about that in a moment. We will build a personalized implementation plan and set some really specific goals around those areas for your team. So that is something that we own at CHDI in creating those plans for your school teams. All right, really quickly about our timeline and kind of the teaming structure. Timeline looks a little funky just because we have schools enrolling at all time of the year. I should mention it's March right now. We may have some of your schools enroll now. We absolutely can do that. However, I've talked with schools recently where they're like, let's, enroll, maybe like get our team together, but kind of kick off in the fall. That's okay too. Every school does their timeline differently, but the work is essentially the same. So every school will start with that first meeting I talked about with all the folks at the table. Starting that needs assessment, you'll get a SHAPE results review from our team, no matter what level the school is at. And then you get access to the trainings and all of the things. But sometimes schools at that point are like, we're good. Our capacity is actually at, an all-time high this year. We really can't take much more on. That's totally fine. Some schools stop at level 1. Going to level 2 means that our team will talk about those SHAPE results a bit more intentionally and say, okay, let's focus on MTSS tier 1, or let's focus on screening. Maybe, DESA has gone to the wayside this year. Maybe we talk about identifying a new screener. So that's kind of at level 2. And then level 3 is just for those schools who really need that extra, hey, we're meeting this month, let's all get together. Sometimes schools are like, we are good internally. We actually meet monthly or weekly and we feel good about that. So we're good with level 2. Some schools really like that extra accountability just to say, let's meet every week. or every month, excuse me, not every week. And at the top there, you'll see just a nice visual of how the teaming breaks down. So again, we always say your school team is at the center of this work. It's a counselor, it's a social worker, it's a building admin. We are coming in to support and kind of wrap around you all in areas that you might need some growth. We are not in your building every day. We're not experts. That is you all. So we often come in and support. And sometimes at those meetings, it looks like a counselor saying to their network of care manager, hey, I have this family. This is kind of a tricky situation with their insurance. Do you have anything you could recommend? And their team is great in saying, let me go back to the table and see what I can find out. So sometimes that's what it looks like too. All right. So for the sake of time, I'm going to go really quickly through our goal, outcomes, just how we've gotten to these goals over the past 2 years, and then I'm going to pass it over to my colleagues to talk about their great work. But I mentioned those kickoff meetings, those first meetings with all of our schools. We have had many meetings since the start of school year 2024 to now. And 92% of those meetings have had a network of care manager and a family systems manager present in person at the table with that school. So we're really able to make that happen with our schools. 64% of our schools since the start of this grant have participated in the Carelon training that Lisa's going to talk about in a moment, what that looks like with our schools. So gotten that community behavioral health, mental health training to their staff. And then 36% of our school teams this past quarter, so this is a quarterly thing we ask our schools to do, have shared information about family trainings, advocacy programs, and peer support initiatives with their families via Parent Square or a newsletter, things like that. So that is also a paid deliverable to share that information out with families. Again, really quickly, goal number 2, increasing knowledge. We have an asynchronous training platform here at CHDI called Educate Smart. There's a variety of different training modules. However, these 4 are the ones that we identify for our year 1 schools. Having 10% of your staff trained in these 4 areas allows you to invoice for funding. So these are just a few of the topic areas: recognizing trauma, trauma-sensitive schools, educational equity, and the Connecticut behavioral health system. You'll see how many folks we've had trained in our Connect schools. This might even be more now. And the knowledge increase on the right-hand side. Again, sorry to be breezing through, but we only have 30 minutes with y'all. Another point about goal 2, we administer a pre and post survey to all of our schools. So when they first come to us, all of their staff completes this pre-survey just to get a base level knowledge of what's out there in the community, who are the behavioral health supports they know about. And then after our engagement with them, we do a post survey to kind of compare the knowledge change. And across the board here, I won't go through it, but you'll see there's been a knowledge increase at every single level, whether it's about comprehensive school mental health, Carelon resources, or family, favor statewide organization. Goal 3, a really, really cool and important one. I just want to highlight, past 2 years, we have been able to offer mini grants to our schools. So essentially at the end of our first year, we realized that we weren't tapping into all of our funding for our schools because not all of them, we accounted for all schools to participate at level 3, which wasn't happening. So we had some rollover funds, which meant we could kind of carry that money over and say, here's an opportunity for schools to apply for a mini grant. I'm putting up air quotes because it's essentially just a really quick proposal paragraph that schools get to complete and say, we want to spend this money on enhancing our educational safe spaces or PBIS, mental health awareness, whatever it is. They kind of do an itemized breakdown of what that looks like, and our team approves that. So that's an additional amount of funding that schools can apply for each year that they're working with us. And it's been really cool to see some of the ways that our schools have spent this funding. You'll see at the bottom, most popular is educational safe spaces, just because that is a Connect goal. We do have all of our schools focus on that area. And lastly, goal 4, those implementation plans. Again, really, really quickly, I apologize. I want to give my colleagues time, but all of our schools that participate at level 2 or 3 have picked an area on the left-hand side to focus on. You'll see that just on the right-hand side, that's how many schools have prioritized that area. So a lot of our schools are prioritizing mental health promotion, tier 1, needs assessment. So you'll kind of see how that breaks down. And one really important note is that you can prioritize more than one area. So this doesn't just have to be one focus area for your plan. A lot of our schools do too. Okay. That was real quick and fast. Again, we will get these slides to go back, and I hope that maybe if there's questions, we can answer them after, but I'm going to pass it over to Lisa Palazzo to quickly talk about the Carelon piece, and then Keisha will wrap us up with favor.
Thank you, Sarah. Good morning, everyone. I'm Lisa Palazzo with Carelon Behavioral Health. I'm one of the network of care managers here. So I wanted to just give you a brief overview of Carelon Behavioral Health and highlight our two divisions. So you'll see there on the left-hand side of the screen, Connecticut Behavioral Health Partnership. Most people know us by that, or CTBHP, because we've been operational since 2006 as the Administrative Service Organization, or ASO, for Medicaid individuals that need mental health and substance use services. And so that's adults and kids, basically anyone that has Husky that needs mental health or substance use. So the Connecticut Behavioral Health Partnership is a partnership made up of DCF, DSS, DMIS, and ourselves at Carelon. Things that they're doing, so basically connecting individuals to services, approving authorizations, working with providers to ensure quality services. And so if someone needs a therapist or whatever services, and they need a provider in their network, they can either give us a call or go online to find a provider in the Husky network. And the other thing I'll note here of importance, the Autism Services Department also falls under CTBHP, and I know that's an interest for a lot of people on how to connect to those services. So they approve and connect to care for individuals who have autism up to 18 for Husky now A, B, C, and D. And then Child and Family Division on the right-hand side, that is where my role lands. So that is contracts mostly with DCF, also DMIS. This is a newer division since 2020. And the important distinction here is that we will serve individuals regardless of insurance. So they do not have to have Husky. Even if they had no insurance, we can still work with them as all of that is grant funded or contract funded. And they're doing services like care coordination and accessing services and care. We have a lot of programs under the Child and Family Division. We don't have time to go over all of them, but if you have any questions specifically about Carelon, either CTBHP or Child and Family, you can contact me or one of the network of care managers. And we have a slide that has our contact information, and I'm sure my colleague Stephanie is also putting things in the chat here. All right, next slide, please. So more specifically about my role as a network of care manager, we cover the whole state. There are 6 of us total, 1 for each of the 6 DCF regions. And our role is a little unique in that we are working more on a systems level or macro level role. So we don't carry a caseload or work directly with families, but we're doing more community organization and collaboration building. And really our goal is to enhance the system of care for kids and families. And so when we say kids and system of care, we're really looking at anyone that supports kids' mental health needs. So that's schools, primary care, mental health providers, DCF, and really just working together to make sure we're collaborating, sharing information, and knowing where to refer to and supporting each other. So some of the things we do to help with that, we develop websites to share resource lists, sharing across social media platforms. We facilitate networking events, presentations, and collaborative events in the community. And really the ultimate goal here is for kids and families to be aware of and have access to the services they need. Next slide. So when schools enroll in the Connect grant, and they'll have access to these trainings on how to access mental health resources. As Sarah mentioned, this is a paid grant deliverable, and so you can bill for this and receive funding. There's a variety of trainings that are listed on here, but when we say trainings, we can be really flexible and customize them, make them shorter if needed, do them in an already existing staff meeting or PD or something like that. And a lot of them are on navigating mental health resources. But one I wanted to point out in addition is also doing things like setting up meet and greets with local mental health providers. And whether that's kind of more of a formal thing or informally, we can help connect to local providers in the area. We can also provide resources on suicide prevention or substance use. Next slide, please. And then some other ways that schools have utilized our staff at Carelon Behavioral Health, in addition to the trainings. So we have provided mental health resource lists that can be used not only by school staff, but also shared with parents. And so some schools choose to do that on their newsletters or Parent Power Square websites. We can also provide specific resources for other supports. So whether that's basic needs supports, connection to local mental health providers, whether that's in that meet and greet or maybe through more informally through an email or something like that. You see the pictures to the right there. Another thing that we do a lot is participate in kind of school resource fairs or parent teacher conferences to really get that information out to the parents about services that are available. And we partner with our um, colleagues at Favor a lot to do those. And then I mentioned the trainings and then really just kind of a customized sharing of information based on what the school needs. Next slide. And then just to stress quickly, put in a plug for Community Pathways. This is one of our newest programs, and it is such a great resource. So I wanted to stress that. It is a warm line that can help navigate and find supports and services. So anyone can utilize it, whether that's school staff, providers, the parent can call themselves. They do need parent permission because we will work with the parent to help link them to resources. So it's a great way if people aren't sure what the process is to getting supports, mental health supports or services, or where to turn, they can call the warm line and speak to somebody directly. And then I think our last slide is just our contact information. If you don't know which region the school falls under, because I know, that's different with DCF land and education, you can always just contact our general contact information there on the bottom as well, or feel free to contact me and I'll connect you. And I'm going to hand it over to Keisha.
Thank you, Lisa. Good morning, everyone. And so I will get straight to it. So we are Favor. We are a statewide nonprofit organization. And like Lisa mentioned, we cover the state of Connecticut. I am the I'm not the network of care manager. I am the family systems manager with Favor, and I cover the DCF Region 1. And so there's one of me for every 6 DCF regions of the state. But I'm going to just get into talking about Favor and who we are. So, Favor, we are a statewide family led nonprofit organization that's committed to empowering families and also the partners that we work with in community. Um, we are here to improve the education and health outcomes for our children across the state and for the families that we work in collaboration with. Our purpose is to offer a single place for families and children who have medical, mental, emotional, and behavioral health challenges, and to find information and assistance and training and education. Next slide. So with this Connect grant, we are basically offering services to family and caregivers, youth and adults, and providers. We're working in collaboration with the schools. We are here to promote engagement with everyone collaboratively. Next slide. At Favor, we have 4 main programs. We have our Connecticut Medical Homes, which is a nice little gem. They offer respite services for families. They are also able to offer supports to families that have children that have medically complex needs. So let's say they lose coverage for medical insurance, they have funding that where they can push in there. Our family peer support specialist with this Connect grant here, they have been really a nice addition to the work that with the Connect schools. They are able to go in the home and work in collaboration with families. Attend PPT meetings, 504s. They really are just a really nice they're really a nice tool for the Connect schools. They are able to assist parents and family members with how to be equal partners. And all of the Connect schools have really been finding that when it's time to have these meetings, families are feeling more empowered with having someone sitting next to them. And so these family peer support specialists are providing that additional support to families. And us family system managers, we are here to collaborate with community partners to encourage family participation at local level tables, statewide tables. We offer training and assistance through our Learning and Leadership Academy, which I'm going to talk about in slides to come. So actually, we can go to the next slide. So when we're talking about collaboration with this Connect grant, we are looking to really meet the schools where they're at. So some of the things that we have been doing is we have been doing tons of outreach events. So we've been going to what you see here in the pictures. We have been going into some of the different Connect schools. And here specifically, this is our family peer support specialist. They have been going into some of the local family centers and providing trainings on how to be your child's best advocate and offering insight to school teams, collaborating with the family systems managers to offer support to families. We are looking to meet the schools and families and youth where they are. So we want to offer and coordinate care base off of the individual school team's needs. Next slides. And on this slide here, you'll see some of the collaborations that some of the family systems managers have done with some of the Connect schools. So we have been able to collaborate with the school staff to identify families with service needs, builds upon school and family engagement through tabling. As Lisa had mentioned, we partner also with our network of care managers to do these events. We provide school staff with professional development. We have been going across the state. That has been really, really a great addition to many of the schools that we've been working with. And assisting with resolving parent and school conflict by modeling conflict resolution strategies. That has been something that the family systems managers have been doing a lot with the Connect schools that we've been connected to. And also putting in other state agencies and community partners to improve access to care and understanding policies and practices. And connecting families and youth to supports within their communities. So many families aren't aware of all of the resources that are available in their communities. And so we have been able to bring more connections to community with this Connect grant. Next slide. And I had talked a little bit about our family, our Learning and Leadership Academy. We have a host of workshops and trainings. I mentioned the How to Be Your Child's Best Advocate. We have like understanding your child's IEP, persuasive storytelling. The list goes on. They're all there on that slide there. We run these trainings on a monthly basis. We have been doing some of these trainings for professional development in the schools. Some of the PTAs have been bringing us in to do them for like support groups. It's been really just nice to bring these workshops to the youth as well as to the families, because as you see there, we also have trainings that are there specific to the youth. Overall, next slide. Our mission at Favor is to really just meet the youth and the providers where they are with this Connect grant. We are with the schools on their journey. No school's mission looks the same. So we are here to meet you all where you are. Thank you.
Thanks, Keisha. All right, folks, we are getting you all right up to 10 o'clock. So I'm going to skip our unfortunate, lovely video of a staff person out in Killingly talking about the work. So I am going to send these slides out to you all with the link to that video if you would like to watch it. I know it's important to hear from folks in your roles about this partnership. So I'll send that out to folks. I did put in the chat a Google form. If you would like to learn more, if you want to get access to our application, next steps is an application. It is very brief. That's a screenshot of it in the top left. It's just a fillable PDF. And from there, we do contract with all of our districts, our schools, just because of that payment process. So it's relatively a quick process. We initiate that contract on our end at CHDI, gets sent out via DocuSign, and we're good to go. So If folks do want to see the application, please fill out that Google form. I will most likely be reaching out to all of you via email. I did last week find everyone on EdSite and at least get my name out there to you all. So if you would like to learn more, please reach out. These are most of our emails here on the screen. And I know that in the slides, you'll also get access to most of the network of care managers. So even if you just want access to your region's FSM and network of care manager, absolutely, we can do that for you. So that is all we have for you today. I appreciate you all being here. If